The THUNDERBEAT device here in my hand is 20 centimeters long. It spins 360 degrees, which makes it nice for working in my field with the hemorrhoids because you're working usually in 3 different quadrants. It has a nice pointy tip which helps dissect the muscle away from the hemorrhoid itself. You can use it in 2 different modes. You can use it in the seal and cut mode, which is the vibration mode, which basically will vibrate and cut through the vessel and give you some degree of hemostasis. For the pedicle, for patients with larger hemorrhoids, I'll tend to pre-treat with the blue button, which is the seal button, which actually seals the button before then I have to vibrate and cut through it. It doesn't have any cutting, so you have to vibrate and cut through the vessel after you pre-treat it with the sealing. The sealing button will treat up vessels up to 7 millimeters in size, and most of the hemorrhoid pedicles are 1 millimeter or 2, so it works nicely there. But it seals it very nicely. This is the newer device. This is the OEJ, or Open Extended Jaw device. I like this one in particular because it's a little bit more ergonomic than the earlier one. It's got a pistol grip handle. And it still has the purple button for sealing and cutting, and then the blue button for sealing. I typically use the purple button for most of the hemorrhoid I do. It's again got a nice curved jaw. It's a nice dissecting jaw, so it works nicely to dissect the hemorrhoid free from the muscle. And when I get to pedicle, I'll hit the blue button to seal, and then cut through the pedicle with the purple button, and that works nicely. So.